Mucous membranes line the body cavities that open to the outside of the body. I kind of like to call them our body armor. The mucous membranes, um, like in the mouth, we're talking like saliva. It has protein that helps to block the growth of pathogens. And the nose has like those tiny hairs that help to trap the microorganisms. The eyes have tears, which help to clean out microorganisms. The genitals, the vagina has a low pH, which blocks the growth of pathogens. And urine helps to rinse pathogens from the genital urinary tract. So mucous membranes do have a role in helping to protect our bodies. Why the elderly are at risk for infection? Well, they tend to be hospitalized more often. They're more prone to skin tears. So a tear in the skin is a portal of entry for infection to get in. Their bones break more easily, and because their bones break more easily, that can put them in the hospital. That can reduce their mobility, meaning they would be more prone to like pneumonia from being immobile. Catheters, indwelling catheters are definitely going to put a person at a higher risk for infection. Malnutrition makes them more of a susceptible host. Dehydration also makes them more of a susceptible host. So the elderly are definitely going to be at a higher risk for contracting an infection. So there are a couple different kinds of infections you need to be aware about. You will see questions on the quiz about this. There are localized infections. These are limited to a specific area of the body. So like in the picture, they show you a skinned knee. Okay, if there is a localized infection there, you might see redness at the site of that scrape. You might see swelling. It may be painful at the site. It may be warm to touch if there's an infection in there. That's a localized infection. Another type of infection you should be aware of is a systemic infection. This is when the pathogens enter the bloodstream and they move throughout the body. So you may hear somebody in the hospital with sepsis. This is what they're talking about. It's very dangerous when it gets into the bloodstream. A person with a systemic infection can have fever, chills, headache, mental confusion. They're usually very, very sick. This is the kind of thing that if you see a resident or a patient and they were previously not confused, but now they are and they're having the fever and the chills, you want to report that right away because there is definitely something going on that needs to be addressed. These are some more terms that you're going to want to be aware of and be prepared to answer questions on the test about them. And that's medical asepsis versus surgical asepsis, or disinfection versus sterilization. So with disinfection or medical asepsis, that is when it is free of pathogens. And remember, pathogens are the bad disease-causing microorganisms. So if you think of like getting a Lysol wipe out and wiping down a desk, okay, you're killing the bad stuff when you do that. Surgical asepsis or sterilization is free of all microorganisms, good or bad. So you're sterilizing equipment that's going to be used in surgery, in a dental procedure, or something along that line. And that means all pathogens are wiped out through a sterilization process. So they are not used interchangeably. They are different. Know the difference so that you can properly answer questions on the test about that. So aseptic measures, you'll find some information in your textbook about this. You'll want to take a look at that. But remember, the floor is always dirty. It makes me cringe when I see a student kneel down in the floor and their uniform is on the floor of the nursing home. Very, very dirty area. We don't ever want to be in the floor of the nursing home. You always want to hold linen away from your body, whether it's clean or dirty. If you hold clean linen next to your body, then you are picking up germs on your from your uniform, from your dirty uniform, onto their clean bed linen. If you are holding dirty linen next to your uniform, you are putting that the germs from the dirty linen onto your uniform. So please always hold those linens away from your body. Do not shake linen. We don't want to be shaking germs into the air. And then we want to make sure that we clean all common areas after use and make sure we're always cleaning from clean to dirty. Standard precautions. You'll want to go through and read these guidelines in your textbook, pages 90 to 91. These are the precautions that you use with every resident, every single resident. Okay. So those guidelines can include things about when to wear gloves and hand washing and how to take care of certain things. So it applies to everyone. We treat everybody as if they've had a disease. We don't know if they're sick or not sick or have some kind of bloodborne disease. You can't tell just by looking at someone. So these are standard precautions. Later, when we talk about transmission-based precautions, we're going to build on that. So the person with a transmission-based precaution will have standard precautions applied and then transmission-based precautions above and beyond that. So be familiar with that. Go ahead and read through that in your book. Hand hygiene. Hand hygiene includes washing your hands with soap, and also it includes using an alcohol-based hand sanitizer. And so there are times when hand washing is by far superior, okay? And there are times when using hand sanitizer is better. So go through and read about this. The CDC does promote using hand sanitizers, alcohol-based hand sanitizers, if your hands are not visibly soiled. C. diff is a situation where you want to actually wash your hands. Hand sanitizer does not help with. You do want to frequently wash your hands when you can, but when you're going from resident to resident, sometimes you don't have time to stop and wash your hands every single time. So you can use the alcohol-based hand sanitizer, and that will certainly help. If your hands are visibly soiled, make sure you're washing them with soap and water and friction. Let's see, we talked about that. Okay, so we're on to wearing gloves. It's important to know when to wear gloves and when not to wear gloves. I'm trying to find that slide. Here we go. You can't just put gloves on every single time that you deal with a patient, okay? That's not really doing what you need to be doing, okay? So it's important to know that why you wear gloves. You wear gloves when you might come into contact with blood or body fluids, with some kind of a drainage, with some kind of a mucous membrane, okay? So if you are taking somebody's pulse, would you wear gloves? No. Unless they have an open wound at their wrist, you shouldn't be wearing gloves when you take a pulse. If you are brushing somebody's teeth, would you wear gloves? Yes, because you're coming into contact with their mucous membranes in their mouth. If you are brushing someone's hair, would you wear gloves? No. There shouldn't be a reason to wear gloves unless they had like an open wound in their head or something like that. But you have to use common sense of when it's appropriate and when it's not appropriate to wear gloves.